What will you do with your one wild and precious life? Welcome to Midlife Woman. I'm your host, Karin Elias. In this podcast, we talk about the physical, emotional, and spiritual changes women go through as they transition into their wise woman years, the years after menopause. This transition can feel chaotic and unsettling, and there is definitely a loss we have to mourn. But what is on the other side? Let's not forget about that second spring we are gifted. And just a reminder, the opinions shared by guests are not necessarily those of the host. And this podcast does not offer medical diagnosis and treatment. If you need medical advice and care, please contact a licensed medical professional. Midlife Woman is brought to you by Dancing Turtles Wellness. Can yoga therapy prevent and even reverse osteoporosis? And what is yoga therapy? Listen to my conversation with Marta Shedletsky, a certified yoga therapist. Marta works with midlife women and she specializes in bone health. She was trained and certified by Dr. Loren Fishman from Columbia University Medical School. Marta mostly works one-on-one. She does have some small group classes and, listen up, a retreat in the Caribbean. And if you listen to the end of the conversation, there is a special treat Marta is offering you. Hi Marta, welcome to Midlife Woman. Hi, so you are a yoga therapist and you specialize in bone health, in preventing and reversing osteopenia and osteoporosis. Now, can you talk a little bit about what is a yoga therapist? Because we're used to yoga teachers.
Very often when I'm telling someone I'm a yoga therapist, I hear, I sometimes go to a yoga class. My sister goes to a yoga class or someone is a yoga teacher. So the yoga therapist, the term is not really well known yet. It's a pretty new field and it's quite different than yoga. I mean, the base of yoga therapy, of course, is yoga. The main difference is that a yoga therapist will use all the yogic techniques like breath, movement, the postures, meditation also, relaxation techniques for specific reasons. So a yoga therapist, we usually work with health conditions, with pathologies as well. And we use specific techniques to achieve specific goals of the clients. Very often it's not just one thing because we are more complex than just the body. So let's say my field is osteoporosis, osteopenia, bone health. And that often comes with other problems that people may have. So often when we learn about osteoporosis, it very often comes with anxiety. And so I'm not only working on the bones, but also offer clients, when I work with them, techniques to help with anxiety, with stress. And, osteoporosis very often also happens, in the midlife. That time in life, we have many other things that are going on. So
basically, as a yoga therapist, you can specialize for some conditions and different people might have a different focus, right?
Yes.
And it sounded like more somebody would come to you and you would do a health intake or even a holistic life situation intake. And then you figure out how can I best help this person? Is that what you do?
Definitely. I work with bones, with bone health. But also there's like so many things that yoga therapy can help with. Like, for example, autoimmune conditions, which I also work with, like stress management, like some spine conditions, let's say scoliosis, or things like sciatica, GI problems. Some of yoga therapies specialize in side effects of chemotherapy when people go through, cancer treatment, depression, loss, grief. So there are mental and physical alike. So I work with people sometimes, who come to me with plantar fasciitis, for example, So these are also things that yoga therapies will work with. For me, the most common was the osteoporosis because of the population that I tend to work with.
What made you decide to be a yoga therapist, and how did you find out that that even exists?
That's a great question. So I didn't know when I became a yoga teacher, the 200 hours, then the 500-hour yoga teacher. I didn't even know that such a field as yoga therapy exists. I thought I invented it, which, yes, because I thought that would be great if I could. So at that time, when I was the 500-hour teacher, after all the trainings that I had, I mostly was working with private clients, mostly women. And very often I would come to the class ready in the morning, usually, would go to their house and ready for the practice. And they would say, oh, by the way, I just torn my rotator cuff. And also I have something else, right? So I also have, and my sciatica, or I pulled my back. And then I was like, whoa, full panic, because I really didn't know what I can still do with them. So all my plan would just fall apart. And I wasn't trained enough. I wasn't ready to work with people. I knew something. I knew some anatomy and, like some things, but I really wasn't ready to work with people with health conditions, like very common health conditions, So I started to research, with specific clients and specific conditions. I started talking with their PTs and chiropractors, what they are doing and how, what I shouldn't do. So first I started doing, learning what are the contraindications. So what postures, because that was about the postures only when I was a yoga teacher, what postures are contraindicated for their particular condition. And I was learning that. So I said, wow, so if I can only not hurt them, that's great, but I would also want to help them. So, the practice can help. So I started researching, what course, what training, what can I do to improve my knowledge? First, I really thought only about anatomy. And I realized that there is a whole field called yoga therapy, and I can sign up for training, and it's 850 hours. So it's a long training and 150 hours of practicums. It takes about 3 years and really intense training. You need to take that. And there is a certification through an organization called International Association of Yoga Therapists. And then I learned that, there's so many problems and conditions that yoga therapy can help. And I even didn't realize. And in the beginning, osteoporosis wasn't my goal. And I even didn't think about it. I didn't know what I would specialize in. I work with women that are my age and older. The greatest hits always are the sciatica and osteoporosis. So, they were saying, in the classes or even in the yoga therapy, when they were coming for yoga therapy for something else, for autoimmune conditions, because that was something that was very dear to me, because I have an autoimmune condition and I'm dealing with it. I'm managing it with yoga techniques, with yoga therapy. That's what I started with. But many women, coming for yoga therapy for autoimmune problems, they would also have osteoporosis, because at this age, this happens very often. So
yeah, that is interesting. And so we maybe should say a few things about when we're talking about women in midlife. We're talking about women who are at an age where they are experiencing perimenopause and menopause.
Yes.
And right, so that's when the hormone levels change. We know that estrogen is changing, but it's also progesterone and testosterone. So we have those three, and the levels are changing. And the change doesn't happen overnight, which is a good thing because it can happen overnight for women who have surgeries, who have their ovaries removed. So that really pushes them into menopause from one day to the next, and that's a very difficult transition. So we're talking more about a gradual transition, but still a lot of up and downs, right? And people might be experiencing symptoms they're not aware of. And we do know that when women have lower levels of estrogen for a prolonged time, a risk factor is osteoporosis.
Yes.
So they might not know that they are at risk.
Yes, that's true.
So we could be living our life and we don't know. So how do we even find out?
So that's a problem here because osteoporosis is silent disease. So it's a silent disease. And most of the time we learn about it. Unfortunately, that's the reality. Most of the time we learn about it when the fracture happens. So we learn about it when we already start breaking our bones. Quite often we learn about it, of course, at age of 65 or different places in the world is differently, but here is 60, 65 when women are recommended to go every 2 years to have a DEXA scan. And then we can learn about the state of our bones and how strong they are, about their bone density, mineral density. But most of the time, unfortunately, is where we start breaking the bones. Let me start with this. There are two types of osteoporosis. The primary osteoporosis that comes with age. So it's like a natural kind of state of affairs. It doesn't have to be like that. We can, of course, prevent, make it better, and improve the quality of our bones. This is kind of natural and expected. And there is the second one you were talking about, when women have a surgery or they take specific medication that change their hormone levels. And then, of course, it affects bones as well. Early menopause. And there are some symptoms. You know that when the symptoms happen, it's already kind of too late. But it's not too late because you can reverse it. So that's a good news. But it's where the osteoporosis happens. So, for example, we are getting shorter. The space between vertebrae getting a little bit less. Also, we are getting that around of the thoracic spine, the kyphosis, the hump on the back, right? So this is sometimes headaches, back aches. But when you're in your 60s, 70s, and you go to a doctor and you tell them that you have a back ache, they will tell you, okay, you're old. And that's not it. It's very often is a symptom of something. Pain is usually a symptom of something different than age. You just have to go and take a test. DEXA scan is one way of being tested for osteoporosis. It's not a perfect test, but it's a good enough one. There is one Ecolight, so it's a sonogram. This one is pretty good. It's not very popular yet. It's no radiation. DEXA scan is very low radiation, so the technician who does it even doesn't have to leave the room. But it has pretty big error margin. And with this Ecolight, it's much better. And there are also, MRIs, which are very expensive, so they are not very popular, but they are great too. When the things are going, into osteopenia, which is the pre-osteoporosis state, the DEXA scan will usually show it.
I'm assuming everybody knows what osteoporosis is, but maybe let's talk about what's the difference between osteopenia and osteoporosis and what's happening to the bone.
Okay. With the osteoporosis and osteopenia, basically it's just the same but different intensity. So we are measuring here mineral bone density, how tight our bones are, how packed they are, especially the spongy bone, the trabecular bone. When we go to get our DEXA scan, we have the results. You can hear two things. There is the T-score and Z-score. So in the T-score, they are comparing the mineral bone density of your bones and of the healthy, basically 30-year-old woman. In the Z-score, it's a comparison of your bones with bones of people your age and your gender. Let's look at the T-score, which tells us about the osteoporosis. From -1 to 1, when you are in that window, it's normal, and there is no increased risk of fracture. Then, when the bone density is lower, when it gets from -1.1 to -2.4, it's osteopenia, which is the pre-osteoporosis stage. And from that stage, it's pretty easy to get back to normal. And then -2.5 and more is osteoporosis. In DEXA scan, they are measuring 3 places in your body. There is a femur bone, so it's the thick bone of your upper leg, the neck of the femur, which is the most narrow part of that bone, and the lumbar spine. So in those 3 sites, they are measuring that. And then we have osteoporosis, so -2.5 and more. When we add to that history of fractures already, then we call it advanced osteoporosis. So advanced osteoporosis is not about numbers, it's just osteoporosis with already history of fractures. And before I get to, what happens with the bones, why this is happening, I just want to make sure that everyone kind of gets it, that the bone density is just part of the equation. Because also what plays a big part in the quality of our bones is the strength of our bones, how thick the bone itself, kind of the shell of the bone, as I would say. Okay, so this is, it's called cortical bone, but this is like the shell of the bone, how thick it is and how strong it is. Some people may have like kind of scary numbers in DEXA scan, but they still have strong, not breakable bones. So it's not always that when you have, really bad DEXA scan, that it means that, you're going to break down. Let's talk about just two kinds of cells in our bones. There are many more and they have different functions, but let's talk about 2. They are osteoblasts and osteoclasts. Osteoblasts, remember the B, it's for building the bones. And osteoclasts is like for chipping the bones, so they are breaking down. So when we are younger, the osteoblasts, the builders, activity is higher than the osteoclasts. So the bones, when we are little, they are building, they are getting bigger, they are changing shape until the age of about 30, when we got our fully developed skeletal system. And that's where we develop the peak mass of the body. And that's our baseline. So it's super important to take care of our bones, not when we are in the 50s already. This is great, but it would be even better to think about it when we are still young and in our 20s, even teens, because the better we build our bones to the point where we are about 30, then we have that baseline to kind of to deteriorate from much, much better, right? So about age 30, we have that peak mass. And then for many years, the osteoblasts and osteoclasts, until, of course, we have some other health condition, right? When everything is okay, the osteoblasts and osteoclasts, they are not changing the structure of the bone anymore. They're already fully developed. So, it's like hair, we are growing and the skin. So the same with bones, they are being broken down and the new bone is built in the same place. So this process is happening and everything goes great until, I'm talking now about the women, in their late 40s, early 50s, they start going through perimenopause and those big hormonal changes are happening. Then the osteoclasts, so the chipping ones, the breakdown guys, they're doing exactly the same as they were doing before, but the building ones, the osteoblasts, are diminishing. So their activity is much less. So there is more breaking down than building. And our bones, because of that, become more brittle and more spongy. and more substantial and very often less strong. So that's what's happening. And for women, it happens in usually around their 50s, and for men in their 70s. So it does happen to the men as well. It's just later.
Right, because aging happens to our body, right? And what you described about bone being one type of tissue, it's building and it's breaking down. That's happened everywhere in the body. We don't
Yes.
have the body we are born with. It's been changed many
Yes.
times.
Yes.
And as we get older, these processes are not as smooth anymore, right? But
Exactly.
women have the additional challenge that because our hormones, they're changing, the levels are dropping, so now we are at a higher risk.
That's true.
And I mean, this is not a new knowledge. We've known that, but I would think maybe the approaches have changed. We do hear, I mean, what you were talking about when you mentioned we need to think about our health when we are young is true for everything, right? I mean, we are talking about having a healthy lifestyle, although when we are young, we think we're indestructible and it takes us some time. But so definitely healthy lifestyle is going to be important no matter what we're looking at, right? What tissue, what system in the body. Then we've also heard, because I want to specifically address this, because now we really hear a lot about women need to do weightlifting because that strengthens muscles and bones. Now, when I'm thinking about yoga, I think this is a more gentle approach than lifting the heavy weight. So, how is yoga therapy helping with preventing osteoporosis or even reversing it?
It's a great question. And I hear it very often, especially that, yes, yoga very often is portrayed, especially for people who don't do yoga, like you're just sitting and doing nothing or just moving gently, like maybe like just moving around and, and just being calm. And, that's the yoga. That was my mom's approach. Okay. It took me very long time to take my mom to a yoga class. She's a very active person. And she says, I'll be bored in yoga class. And she wasn't. Yes. And the weightlifting. Yes. I'm on a few Facebook groups for the osteoporosis, different, osteoporosis groups, natural ways to prevent osteoporosis, etc. And this is one of the most common questions about the weightlifting. Yoga therapy for osteoporosis is based on that as well. The way I practice that and I teach that is I use Loren Fishman's method. And Dr. Fishman he's an expert in osteoporosis. He wrote many books. One of them is Yoga for Osteoporosis. It's very lucky because he's also a medical doctor associated with Columbia University and a yogi that studied with Iyengar, with Mr. Iyengar. It's a very rare combination because yogis usually don't have money to do the studies and the research. And medical doctors usually not interested in doing research on yoga. It's, there is no money in that. So here is one who is a doctor, who really wants to help people and who has access to the equipment and to some funds for research. And Columbia University is not just any schools in the middle of nowhere. It's an Ivy League school. So he conducted a big study. So now I think it's over 10 years. It's over 250,000 hours of yoga that he had his subjects go through. And I will tell about this method in a moment, but I just want to tell about the research that he did. The results were his method is 83% effective, which is, I think it's an amazing result.
Yeah.
With no side effects. So it's over 250,000 hours of yoga with no major injuries, no injuries due to that system, to the yoga itself. Most of the people were actually able to improve, depending where they were in the beginning. Their bone density was measured from like 2 years before starting his method, practicing that yoga, and then 2 years after. and 83% showed improvement. So if they had really bad low numbers, bad osteoporosis, they got either into like osteopenia. Some of them were able to go back to normal. And some of them were, at least they were not decreasing their numbers, which for many people was great enough.
Because the alternative is to take medication, right?
That's true.
Well, medications always have some side effects. Do
They
you
do.
know the comparison of effectiveness of taking the medication versus the yoga therapy?
It's not possible to say exactly because some of the people were taking medication during the study, some people were not.
Yeah.
However, what I can say, they didn't show 83% improvement with no injuries. The yoga not had any negative side effects. It had some positive side effects because it added good things, like, for example, better concentration, calmness, the feeling of community if you were taking a class. There's so many positive side effects, I'll say, quote unquote. But with the medication, there are problems with the medication. I mean, I don't say the medications are bad, not at all. It's, some people have to take them. And, I don't say they shouldn't, quite opposite. If the doctors say they should, of course. However, there are some problems. Not everyone can take those medications because of some other medical conditions. They are not good for everyone. B, they can only be taken for some period of time, not too long. It's usually, I would say, 2 to 4 years or so, and then the doctors have to change them. And there is also the problem with the side effects like GI problems, so gastrointestinal problems. There are problems with, some headaches and also the bone aches, and 2 worse side effects that can happen, and they are not very rare. There is osteonecrosis, which is like dying of bones, and spontaneous fractures. So, that the medicine that's supposed to help you can also cause spontaneous fractures. So, and this happens. Not always the medication is answer to everything.
And for you, because you are in New York, you had access to Dr. Fishman's training, so you studied with him?
Yes, I did study with Dr. Fishman. I did his training actually online. I could be anywhere I wanted, so it's pretty accessible. It was quite a pleasure. This training, it was a few days, very intense. We had those elements in my yoga therapy school. It's Breathing Deeply Yoga Therapy School. We had a whole module about, osteoporosis, about scoliosis. So we did have that. And we were actually using Dr. Fishman's method. So in yoga therapy school, I knew a little bit about that and I knew how to use his method. But when I learned that I can actually learn from him and train with him and had a little bit of a practicum with him, that was amazing. And I still, now and then, I'm taking his trainings and I'm taking his classes. In 2 weeks on Saturday, finally we'll be able to see him in person and train with him again. So I'm very excited about that.
I will want to know how this works, but I have another question first. I'm working with women in perimenopause and menopause, and many of them are surprised by what's happening to them. They feel they didn't get prepared for some of the symptoms. We do know that osteoporosis is a risk factor for women, and it's always better to prevent it than having to deal with it and reverse it, because it might work, might not work, right? So when you think about women using this as a preventative tool, would you say at some point they should, like if they've been doing yoga already, at some point they should switch to yoga therapy and be more targeting the bone strength? Because we don't even know we have thin bones, right?
Yes. As you said, women start losing the bone mass during menopause. And during the 5 or 6 years that, the big changes happen, we lose about 10 to 20% of the bone mass. It's a lot. Later, after menopause, it's about 0.5% a year. That 5, 6 years when we hit the time in our life when everything falls down and at some point people think we are crazy, we go through the mood swings and things, we should be helped then.
Yeah.
Treated with kindness and love, Many of the people who have osteoporosis, many yogis, many people who've been practicing yoga their whole life, they still get osteoporosis. So it's not yoga itself, not the postures, but how you practice them. The sequence that Fishman developed is just 12 postures. And his method is based on Wolff's Law, that in simple words says when you put pressure on the bone for a specific period of time, the bone in that place, in that particular place, is getting stronger. So when you're putting pressure on the bone under specific angles, along those lines, the bone becomes stronger there. So the greatest hits and the bones that we measure on DEXA scan are the femur bone, femoral neck, and the lumbar spine. So Fishman developed 12 postures. He took them from yoga. He didn't make them up. He took them regular postures from yoga, like warrior two, like some twists, locust pose. There are a few postures, the tree pose, but the idea is that you need to be in a perfect alignment and you have to hold those postures, putting pressure on those bones for about 30-45 seconds. Because the Wolff's Law that says that, the bones become stronger when you put pressure, like constant pressure on that bone, it happens between 12 and 72 seconds. So somewhere around 30-45 seconds that you have to hold this posture. And then you have 12 postures that include Shavasana, the final relaxation. The whole practice done in a very specific way and in a right way to help increase the bone density and strength of the bones, it takes about 20, maximum 25 minutes. You have to do it daily. I wouldn't replace, but I would add that to my yoga. So let's say I'm practicing yoga a few times a week. I'm trying to do 7 times a week my yoga therapy for bones, the Fishman's method. And then, I can still do my regular yoga. However, if I know that, let's say, I have osteoporosis in my spine, in my lumbar spine, then there are some postures that are contraindicated. So when I go to a regular yoga class, forward bending, for example, is a big no for me. I cannot do that anymore until I increase my bone density and maybe go back to a normal, and then no problem. But as long as I have osteoporosis, there are some postures that are contraindicated. The question that you asked, yoga therapy and a yoga class. In a yoga class, the teacher just takes everyone as they come with the idea that everyone is at good health. So most of the time, they don't tell you the contraindications. Basically, if they were doing that, everyone would have to have different class. There would be no yoga classes. They're just thinking you should take care of your contraindications, like what you shouldn't do. And since you are here, you know what you are doing, just following the class, right? In yoga therapy, it's different because a yoga therapist works one-on-one most of the time, or the group with the same condition. And the yoga therapists learn about the medical contraindications. We are good at that we can adapt the practice. So Fishman's method is amazing because everyone can start it at any point. Basically, even if you are in pretty poor condition already, every posture has many stages. So you can do it with a chair, or you can do an intermediate, and then you can progress. Or you can do the regular classical version of the posture. So the tree you can do in so many ways, as long as I'm hitting the point where I'm putting pressure on a specific bone in a specific way. I can do it with chair, without the chair, with a wall, like this way, like that way. But, I need to have the alignment to strengthen that bone. So every posture in this method is taught to students in a way that each of them will be possible for them to be done unless they have a different contraindication, not osteoporosis. Let's say they have like bulging disc in the spine or something like that, or like a big scoliosis. So then they have different contraindications. But here again, the yoga therapist will know what to give them instead, or how to teach them to do this posture so they don't hurt themselves.
Yeah, so what I'm hearing from you explaining this is that if somebody is practicing yoga, and let's say it's a woman, and gets to be to a certain age, it might be a good idea to consult with a yoga therapist as a preventative remedy to, learn postures that help with preventing osteoporosis, because the tests aren't done on us at a younger age unless we've had some risk factors, right?
Yes. It's not only that, but as we age, our body goes through a lot. We drive, we work with computers. Usually, it's not anything that's positive, the changes that we have through that environment. But also, very often we are active women and we go to gym, we go to different yoga classes, or we run. And all those things we want to do because of good health. We want to do to improve ourselves, to help ourselves, to keep ourselves longer healthy and active. So what happens is quite often when we do repetitive things, we may actually hurt ourselves. Those things are changing our body, and we hope they are changing in a positive way. Yet we hear about sport injuries all the time. And as we age also, our body change, and things that we were doing in a specific way 20 years ago, maybe it's time to just take a look and see maybe we need to move a little bit differently. And at some point, many of us give birth to children. Every child is 9 months of carrying the belly. The spine gets so much beating, our hips, our pelvis, our pelvic floor. And 9 months of pregnancy, giving birth to a child, labor, like a natural labor or C-section. C-section is a major surgery. 6 weeks later, you come back and as if nothing happened. Well, this is like major. They cut through all the layers and they just let you go without PT.
Yeah, and even I'm thinking now, because in order to give birth, we have to get more flexible. So we're releasing this hormone to open the joints, which then gets reversed. And I know, because I'm a massage therapist, and I know many women who have issues with the sacroiliac joint because it didn't align well. But yes, and that could be dealt with right after birth if we had a different kind of aftercare.
Exactly. And in the body work at that time, like a medical massage, the women are developing scar tissue. It changes your body with scar tissue, C-section, just your C-section. It changes your whole body, and how it just functions. And this is really interesting how little we get help. It's incredible when you think about it, like how women are treated, right? Like how little we get. That's why, when you're doing any movement, it's a good idea to actually work with a body worker who knows what they are doing. They can check your structure, and a yoga therapist will help you definitely. I'm not a specialist in, like, for example, the gym exercises. I don't know much about that. I have clients who practice Bikram yoga, for example, here in New York town, and they are at age where they start their osteoporosis. There are many postures that are perfect for osteoporosis, no worries. And they love that Bikram. They don't want to give it up. But there are some postures that are very iffy for osteoporosis or for other conditions. So I have women who come to me and we go through the whole sequence that they are doing in Bikram yoga. And I'm looking at them, how they are doing that and what can be dangerous for them, and how to do that posture without endangering themselves. It's great, go to your yoga classes. Why not? It gives you community, it gives you that workout a little bit, and the spiritualities, all the ways that yoga can help. The main principle of yoga, and I think that's the most important thing, is ahimsa. Ahimsa in Sanskrit means non-violence. And that's the main principle of yoga. That means non-violence towards others, of course, and towards yourself. So when you go to a yoga class, and you start doing things where you hurt yourself, it's not ahimsa. So it's not yoga. Making sure that the yoga actually is beneficial, that it helps you, that it doesn't hurt you. It's important. So when you go to a yoga class, go and see a yoga therapist every few years just to check, is my body still okay with this posture? How can I do it differently? Maybe I can go deeper, actually. Maybe I improved my posture and maybe I can go a little bit deeper or different, because yoga changes the body. I can see, like for myself, it does change the body, because if I do repetitive movements, they do change. So if I do my cobras every day, I get nice and strong upper back, keep my shoulders back, and my spine is happy. But if I do a posture that is not good for me, I can actually develop some problem. Even Dr. Fishman, it's fun to say, he said that he was writing a book and he was doing pictures. He was getting ready to do some photo shoot for scoliosis. He's great, like he has great research on scoliosis as well. So he was doing the postures on one way. In scoliosis, you do postures only on one side because they are supposed to strengthen the other side. So he said that he was doing it for a few weeks, getting ready for the photo shoot. So he wanted to look good in the photo shoot and kind of get deep into those postures. And he said that he grew himself as scoliosis. Of course, he reversed it later, but in a few weeks of doing postures, over and over again the same way, he said he got some mild scoliosis.
Yeah, and we also have different types of yoga, right?
Yes.
Some are gentler, some flow more, and people don't necessarily, like when they start, they are not the experts on the system, and often they are not really fully aware of what's happening in their body. So I can totally understand when you say consult a yoga therapist so that we can give you some ideas on what you should avoid. And also that makes me ask you, because people who do yoga, they go to yoga classes on a regular basis. How many times do people come to see you when they start to work with you on a specific issue?
So that depends on the issue. It's different than with yoga, because with yoga, you go once a week, twice a week, whatever, you go to your yoga classes, and you can go till the end of your life. It's as long as you can. And it's amazing. And that's the way it's supposed to be. It's a long life practice. With yoga therapy, it's a little bit different, because the yoga therapy is to target specific condition and to kind of fix it. As I said before, I'm having scoliosis, let's say. So I'm working on my scoliosis until my curve gets okay. If I continue working on that one side, I will develop scoliosis on the other side. What I do, I see clients, also it depends, on their finances. I always ask if money is the issue. So if it is an issue, we are doing it maybe less frequently. They are doing a little bit more work on their own. If money is not such a big issue for them, we meet more frequently, but it's usually once a week or every other week. And then they do their homework in between. That's the deal. They need to do their work, and we develop their practice. Let's say we are working on anxiety. So they learn those practices and they are their own, and they come to me as long as they need to. Some conditions require a person to come to me like maybe for a year or 2 years even, before they develop a condition that they can keep on their own. They have all the tools, and then maybe they come like every 3-4 months just to tweak things, or maybe they fell off the wagon and they need to kind of refresh everything and kind of need more accountability. But if this is like a bone or some physical issues, it's usually from a few visits, from few weeks to maybe a few months. And then they're good on their own and they are practicing as long as they have the problem. With osteoporosis, most of my clients, when they come privately to me, if they don't have tons of coexisting conditions, that's 6 to 10 visits. Later, when they do it, they come after maybe 2 or 3 months, and they develop strength in their muscles and they can kind of move forward. So some of the postures that they were doing at beginner's level then may go further and they are learning how to do them. Okay, I'm strong enough to maybe do it without the chair or without the wall, without the block. That's why they come to me to kind of tweak their practice and update it. With the mental health, it's different. We find the practice that works for them. So what I do with my clients, I see them. And so depending on the condition, right? It may be some movement. Very often that's what it is too. Sometimes there is meditation as well, or some mindfulness techniques. Quite often it's breath, either with movement or standalone. Depends on the condition and on the person as well. And then we see how much time they have. I will give different practices for a mother of 3 who runs around, and different to person with the same condition who is already retired and has more time and, can spend more time, because it usually works better when you do the practices. But I want the person to be successful. So I won't give, a single mother of 4 a practice that's 25 minutes, because that's too long for her and she won't be successful. So, we'll build up. Let's say she has an anxiety, right? And also, scattered mind and ADHD. So trying to find practices that will balance her so that she's able to take a little bit more. So first we need to balance the person. So meeting them where they are, seeing what's their life situation, what they want, what they can, what kind of time, because they may not want to do that much. And that's okay. My job is to find something that will work for this person who only wants to give this practice 15 minutes a day. And, and my job is to find it. Slowly, it will build up. And I explain, of course, I'm transparent. I say, okay, if you do it for 50 minutes, it will probably work better. If you do it for 15, it will take longer, but it will take you there. Or I will tell them this practice won't work if you don't give it whatever time, So, and I don't tell people what they want to hear. I tell them what works. And very often I tell them it's try and error. We have our, ways to deal with different conditions. We have protocols, but it's just guidelines. Every person is so different that the protocol doesn't always work for a person. It's just a starting point. For example, she doesn't like to breathe. She doesn't like doing breathing exercises because it makes her freak out. I have people like that. I cannot meditate because it makes me just wow. I tell them, no worries, we can do it differently. And then I find other ways to approach this program. And very often, in some period of time, those people are ready for breathing and meditation. And it's just not at this time. First, they need to just run, for example, or go for a walk. It can be also a yoga therapy, very often just going out is one of the tools.
So highly customized and flexible, like looking at the progress of the person and always making adjustments as they are growing along. Yeah, really positive reinforcement.
Yes, they need to see that it works and they need to like it also. Of course, there is certain amount of discipline. Doesn't matter what happens. When you don't do it, it won't work. Let's say I find something for them. I find a practice. They come and they say, I like it, I'll do it every day. And then they come in a week and they say, oh, I didn't do it even once. So then I ask why, what happened? So how can I help you? They told me they will do it every day, but they actually work every day, 2 shifts. And then we are working a little bit more on the planning, on their schedule even, They're sometimes very busy. So then my job is to figure out what would be the easiest and fastest way to get them where they need to be.
And the good part is that you're working in person, but also online. So that cuts out that travel time.
Yes, many conditions I can do online. Sometimes I see people for the first time, especially with the physical things, in my office in Yorktown. Later, we meet online if they're comfortable with that. People from Long Island and from different states that just cannot come here. I do see private clients online and in person. I don't teach group classes that much anymore. I have 2 classes. I have one at Westchester Community College. It's Intro to Yoga, how to do yoga safely. And the other, I'm just starting at Yorktown Heights. It's a gentle yoga. It's basically like a group yoga therapy for everything. And I have a group class for healthy bones for the osteoporosis. It happens every semester at Westchester Community College in Valhalla. So the next class is in January. It's a group class, 12 people max for osteoporosis, where they learn the whole Fishman's method. And I have enough time and space with them. It's a small class, so it's almost like having a private session, but very, affordable. In April of 2025, I have a Caribbean retreat, 4 days in the Bahamas, in a beautiful yoga retreat on the beach. And it's very affordable too. I think it's just $400 or less, plus the accommodations. It's on the Paradise Island in Shivananda Yoga Retreat. And it's 4 days where people will be able to work with me on the Fishman's method. Very comprehensive. And not only Fishman's method, but it will be also about lifestyle and about some diet, whatever it is. So it's going to be 4 hours a day with me, but they will have another 20 hours to be with the ashram, doing different yoga classes there, taking lectures, meditation, and the beach time if they want also. It's beautiful.
That sounds very relaxing.
It's a great excuse, taking care of my bones.
And people find you through your website?
Yes, I can be contacted there, and I have Calendly there. So, if people want to talk to me about their, health issues and see how yoga therapy can help them, I offer complimentary phone consultations. I do have Instagram, but I'm not very active there. I'm more active on Facebook. So it's Mushika Wellness. So for the listeners of this podcast, of this episode, normally my hourly rate is $120. But for the listeners, the first meeting that we have, the first visit, until the end of this year, 2024, I'll gladly do $80 for this first session of hour and a half. And of course, the consultation is free. Everyone can call me, see how yoga therapy can help them.
Thank you. That's a great opportunity to get this started, right? Taking care of one's bone health. I thank you very much, Marta,
thank you for this opportunity.
Today. Yeah, and for giving us the insights. And now people will find out more about yoga therapy, and we can spread the word. And we learned about your expertise, and I really appreciate you sharing all this with us. So thank you very much.
Thank you so very much for this opportunity and for sharing my passion. It's all about yoga therapy and about the bones.